What's up, everybody? This is Dr. Zach Baker, and I have with me Dr. Corrie Jones. You are listening to the Strength and Knowledge podcast, and today we're going to talk about students. And we're fortunate enough at Rehab to Perform to have a very extensive internship program. It ranges from high school students to undergrad students to physical therapy students doing clinical rotations as part of a formal affiliation with their school. And then not necessarily an internship, but we also have residents that are doing postdoctoral time with us. So we do a lot in regards to providing educational opportunities, exposing them to what the real world working environment looks like, offering some mentorship. I'd say probably some unsolicited mentorship at times. But we get to interact with a wide variety of people with a wide variety of goals. But I do think that there are some things that remain universal regarding how we approach the experience and what certain people are doing that get the most out of that experience. So, Corrie, you are very instrumental in the internship experience with us. Do you mind shedding a little bit of light on how you have seen students be set up for success during your time with us?
Yeah, I would say there's a couple of things that come to mind, like initially. One of the main ones I would say is clear expectations. So making sure they know what they're in for and what they're going to be getting after when they're here. Another one that comes to mind is making sure that they have a framework early so that you can refer to it regularly with them and really help them to structure things easily because they have this foundational expectation and foundational principles. And then I would say the third thing that comes to mind is basically a safe to fail learning environment. It's kind of one of those last times before they're on their own, if they're DPT students, but in general, you don't want your students to ever be afraid of asking questions or progressing or whatever. So basically making sure there's a learning environment where it's safe to fail.
I love it. And this obviously isn't an exhaustive list. And I think we could probably go on for a while in regards to things that we've had success with, maybe some shortcomings we've had. But I think most of the shortcomings that I can think of as a clinical instructor, or when I look back to my time as a student, it really circles back around to one of these three things. Either there wasn't a great understanding over what your roles, your responsibilities were, or just what you were supposed to be doing on a day-by-day basis. And you're kind of tiptoeing back and forth, like, am I doing too much? Am I overstepping my bounds? Am I not doing enough? Or there's no framework, and there's a fine line between providing independence and autonomy and just winging it. And you need to figure out what that balance is. And then I think we're all accused of this at different points in life in our career where, like, you're embarrassed to do something wrong. So that often leads to people just holding back because they don't want to hurt a patient, or they don't want to mess up a plan of care that their clinical instructor has, or they just don't want to be looked at poorly by their peers or amongst who they hope to be colleagues in the future. So I think having clear expectations, providing some sort of framework, and just letting everybody in on the fact that, like, hey, you're going to screw up and that's fine. We're going to give you guardrails so that there are small mistakes. Nobody's going to be harmed, no harm, no foul, and it's a learning opportunity. What are some things that you've done when we talk about creating clear expectations? What do you try to do with your students, or what are some of the expectations that you have with them?
Yeah, I would say one of the first things is just on that first day, explaining exactly what you just said. So what are your roles and responsibilities? Here's what to expect when you come to RTP. We really do try to provide a learning environment. So it's explaining to them, we really need you to get to know the patients first. We don't need to throw you into the fire. We actually want you to know people so that you can better plan for them individually, plan for their personality, all that good stuff. So getting to know them, and then also like what expectation I would have as you are planning for these patients. So is this something that I'm going to drop you in and give you 12 patients on the first day, or can you expect a build up? So for us, it's literally get to know the patients the first couple of weeks. Then I'm going to give you a slow build up, 3 to 5 patients. Then as you show competency, I'm going to show you more and more. And the same comes with like even just the culture of the clinic. So we have this thing at RTP Frederick where at the end of the day, you make sure you go around and ask everybody in the clinic, is there any other way I can help before I leave? What's the expectation for cleaning up or washing a table or doing documentation? I literally have a list that I run through with my students that literally says student expectations so that we can run through them on the first day to say, if you're not meeting these, it's not the end of the world, but it's something that we're going to chat through because this is what will make the experience go well for you. It's nothing that's unreachable or unattainable. It's more so just if we want smooth communication and we want a smooth experience here, these are the things that are going to work for both of us so that we're really communicating well. The other thing I would say, the last thing I would say maybe is giving them strategies to communicate and to clarify these expectations. So I have a couple of Google Docs that I share with students. Here's what you're planning for patients. Here's the feedback that I'm giving you day to day so that it's not like an embarrassment in front of the patients, but more so something I can do with them individually at the end of the day. And then it's also, let me give you feedback about your documentation at this point in time. So really making sure that you have all these different avenues for communication to say, yes, we have some expectations of you, but I want it to be very clear in each realm of your experience here. So whether it's patient care, documentation, company culture, it's very clear to you what I'm hoping for you to bring. And it's very clear how you can address things with me if things are not going well. So yeah, just trying to make that really clear. All of it's about communication. But the more expectations we have, the better it is to say we're either meeting these or not meeting these.
And I think that's what I've learned is when you have these conversations early and when you have clarity within the conversations, providing things that are written, providing them resources, explicitly talking to them in person about what you are hoping to accomplish. If something's not going well and you need to do something maybe a little bit more formal about it, you've already had a touch point on it. Everybody has acknowledged it. You have something that you can reference back to. And it makes you more confident as a clinical instructor if you do need to ask more of them or enforce something or hold people accountable. Thankfully, that does not happen very often if you do what you said in the first place of just creating clear expectations. Now, you had also mentioned providing a good framework for students. What do you mean by that? What does that entail, or what have you done previously that kind of illuminates that?
Yeah, so the best way I would say to describe this is context, right? So if I'm going to be asking you to plan for patients and I consistently am asking you, hey, I want you to give them this exercise, and you give me something and I say, well, that's not quite there, I have to be able to give you a why. One of the things that we really try to clarify early on for everybody is phases of rehab. Hey, this patient's in phase 1. Here's what we're expecting for phase 1. This patient's in phase 2. Here's what we're expecting. Some of those kind of things that you're going to be referring to early. So I would say phases of rehab, I'm explaining early, so I can refer to it often. I would say strategies for progressing and regressing TheraX. We're talking about it week 1, week 2, because I need to be able to refer back to it. If we're progressing plyometrics, I'm trying to talk through that at least week 3, 4, so that they can refer back to it. If we just throw them in the deep end and we say, I need you to give me these 3 mobility exercises, these 3 stability exercises, they need to be appropriate, they need to be timely, they need to be all these different things, but you haven't provided a framework or a context for providing treatment to patients, those conversations are just so much harder because they want to know, is my planning correct or accurate or helpful? Is this what I'm supposed to be doing? Or even assessment, so it might be evaluation too. If you can't give a why or have a reference to anything, then it seems all very subjective. Hey, my clinician, my CI doesn't like me very much because they say this is not quite where it needs to be. Or, hey, they don't give me any feedback because they say everything's fine, right? So I think having a context for all that stuff, here's my strategy, here's my way of doing things, here's my structure to things. 2 things, I think. 1, it adds to conversation. So it can say, here's how I do things, but I want to know how you would do it different. Or I want to know what you would add to this as a student. I want to know what you learned in school that you can progress my ideas, right? So it adds for a little bit of conversation, a little bit of back and forth so we can challenge each other and grow that way. But then again, kind of back to what we already said, clear expectations. If I need to keep my patients safe, I need to keep them progressing in a plan of care and get them to a safe, happy, excited discharge. We need to have some base level frame of clinical conversation that really makes sense to both of us so that we can progress patients together versus kind of having this back and forth situation. So yeah, I think just having like a framework of here's clinically what we're expecting in the office here really helps to lay a foundation for clear communication as we're working together with patients.
I think it also adds validation to what you're making recommendations for. And you had talked about eliminating or reducing the subjectivity with your recommendations. If you can point to them something that's very concrete, something that is very evidence-informed, something that has lasted the test of time and has had good outcomes previously, then it's no longer Corrie's opinion on what we should or shouldn't do. It's, hey, right. Corrie practices based on all these principles that have an abundance of literature behind them and a very long track record of success. There's probably something to that. So I think it also helps you connect with the student, and they have a better idea as to what your knowledge base is as well. Now, at some point, a student's going to do something wrong. At some point, when we were students, we did something or many things wrong.
Sure. Yeah.
So it's going to happen. How you approach that obviously is going to play a large role in regards to what the next outcome is. But how do you foster an environment that encourages learning? It is a safe to fail environment, but at the same time, you don't just set the expectation of like, hey, you're not going to do well. I'll let you know when you screw up and we'll fix it. So it's a fine line of not being complacent and just saying like, oh, it's okay if you mess up, because we have high standards. And the expectation is not for people to fail and then us to come in and save the day, or just that it's okay to fail all the time. But there is a realism there where we need to appreciate perfection does not always happen. And when things are not perfect, how do we learn to live with it? Or how do we continue to optimize? What are your thoughts there?
I think some of it comes down to providing different environments. So by that, I mean, when you are together with a patient one-on-one, the hope is, again, that you have already communicated with each other the plan, the opportunities, the things that you want to actually work on, so that is a place that's a little more of a pre-planned, here's what we're going to do today. Now, things can go wrong even when you plan for it, right? So it's making sure that they understand even that piece. But that is a more predictable environment because we've reviewed it. Maybe another environment would be one where I'm going to challenge this student to grow a little bit. I'm not going to pre-plan with them, but instead I'm going to have them plan independently, and I'm going to give them feedback on it. So that provides I would love for you to plan for this patient. I want you to explain your clinical rationale and your clinical reasoning to me as to why you're doing what you're doing, so that this is a separate conversation away from the patient, where they're not going to be judged by immediate outcomes, right? Because the patient isn't there. And yet independently, we can have these clinical conversations to say like, that sounds really good. I really like it. Or that sounds like, hey, that might be a safety thing. Why do you think that's a safety thing? And start really challenging their reasoning, I guess is what I would say. And then again, like maybe another environment is what I said earlier, is I kind of use a Google Doc. If they're doing really well, but I want to give them, let's say, an anecdotal or a clinical pearl, I'm going to give them just feedback on this document that we have so that we can just review it at the end of the day. So it's not in front of a patient. The patient's not losing any trust in them. But instead, they're just we're adding to their clinical knowledge, right? So you have these different environments, and I think that allows you to then work with the student and say, hey, our safe to fail opportunities are when we're chatting with each other. When we're with a patient, we really need to think safety first. And hey, we have a plan that's pretty accurate and, again, evidence-based, so that there's less likely that could go wrong. The last thing I would say to just emphasize is this all kind of comes down to CI personality and a little bit of that social emotional IQ, right? So all of us have good and bad days. All of us have days where we're on top of it and ready, and other days where the friggin' car didn't start and the ice is on the windshield and I can't get it off and I'm not there on time and I'm stressed out. So things happen. So I think it's kind of making sure as clinical instructors, we understand that if we have off days, so our students are going to have off days too. So extending grace when grace is due, and remembering that the answer all throughout PT school is it depends. There's no right way. There's no perfect way, but more so, I need to make sure you have clinical rationale for all of these things. So again, a safe to fail, you tell me why it depends on what it depends on and give me your best clinical rationale, but I'm not going to tell you you're wrong. However, I do want to understand why you're saying it the way you're saying it. And once in a while, I might give you a better way of doing it just because I've been around longer. So I don't know if that answers your question, but kind of, I would say those are my things, giving them different environments, using your social emotional IQ, and just making sure that we give them grace, because we know, again, where we were when we were their age. And I'm still failing to this day. Though you hate to admit it, you're like, hey, I'm still learning. So there's that.
No, I love it. I think these are things that are going to continue throughout your course of career, through your clinical rotations, through your first year of practice, and ultimately through your entire career. And honestly, if you're thinking that they are not still occurring, you're probably just not caring enough, and you're just going through the motions and you don't realize they're occurring. So, Corrie, appreciate the time. If you enjoyed this episode, please share, like, and subscribe. You're listening to the Strength and Knowledge Podcast. This is Dr. Zach Baker, Dr. Corrie Jones. Thanks for listening.